我哋16個議員嘅，今日有個咧就係
We need 16 members for this joint panel meetings for members of the panel on health services, panel on education, and panel on welfare services. Thank you for your attendance. We have formed a quorum. I now call the meeting to order. First item, election of chairman. You can't hear me? Okay, I can speak louder. First item, election of chairman. Because the chairman, Ms. Ann Zhang, and chairman of the panel on welfare services, Mr. SHIU Ka-chun, both think that it's better that I chair the meeting, so I will be the chairman. Second item, mental health of children and adolescents. We have officials from 3 government departments, and we have received a letter from Mr. SHIU Ka-chun. They would provide a written, an oral response in a moment. And Dr. Pierre Chan has just made a submission.
有關嘅文件咧，我就唔一一討論啦。咁啊，或者咧
，and the government will provide a response also in a moment. So after the officials have seated, I would like Mr. Fong to introduce the paper. I have to say sorry on behalf of Dr. Chui, the Undersecretary, who has to attend to some urgent business, and he will be here to join us later. So I would be introducing the paper on his behalf. Mental health of children and adolescents is an essential part of overall health of society. A good mental state can help children and adolescents fulfill their lifelong resilience to adversity and improve future life chances. Therefore, the government attaches great importance to the mental health of children and adolescents and provides cross-departmental support, including the Food and Health Bureau, Labor and Welfare Bureau, Education Bureau, Department of Health, Social Welfare Department, Hospital Authority, in providing support and services. We have early interventions, assessments, and we also have Child Assessment Service of D of H, Student Help Service of DH, and CNA Psychiatric Service of HA. And the HA provide the relevant assessment and DEF services, and HA provide the necessary treatment and rehabilitation services. This is to make sure that the children with the needs would be provided with the necessary services and support. Members may refer to the discussion paper for details. On the other hand, in December, we have set up a consultative committee on mental health, which would advise the government on how to provide more comprehensive services for different matters in respect of mental health overall speaking, and including the mental health of children and adolescents. And we also continue to monitor the recommendations and the implementation. The advisory committee has held 4 meetings. It's almost on a monthly basis, and there have been 10 meetings with relevant stakeholders to discuss issues related to children and child and adolescent mental health services. And the advisory committee will attach priority to the discussion on child and adolescent mental health issues, and then they will look at the recommendations coming from the advisory committee, and also will follow up the discussion closely. The relevant services and issues in relation to this topic are set out in the paper. My colleagues and I are happy to take questions. I think I should pause here. This meeting will last until 6:30 p.m. So far, 4 members would like to speak. We have Dr. Kwok Ka-kay, Mr. Alice Mack, Mr. SHIU Ka-chun, Mr. Luk Chung Hong, and Mr. Poon Siu Ping, and Mr. Kwok Wai Keung. Everyone is given 3 minutes, so we may have a second round. Dr. Kwok.
Now, I'm very disappointed at the attendance by officials. The Food and Health Bureau, the secretaries, and also of the Labor and Welfare Bureau, the secretaries are not here. So the government continues to ignore the issue. We have 70,000 odd children who need mental health service. Now the HA provides about 34,000 places, and it used to take 3 years, and now it's 74 months. So they have to wait for almost 2 years. Now the government repeats the same information every day, and then Won Yan Long has become the person who is facing all the criticisms, and he's not the right person. And this term is almost over. There are almost 70,000 children waiting. Now I've written to the financial secretary asking him to use the surplus funds to resolve the issues. Now the HA makes use of public-private partnership with NGOs for help, and the response has been zero. So we wait a few more years for Won Yan Long to be the target of criticisms, and then the Education Bureau, the Food and Health Bureau sends someone over. The Food and Health Secretary and his Undersecretary are not here. Now, what can you deliver? How many more years do the children have to wait? Even if you act now, they have to wait for 2 more years plus. And how long are you going to wait, Mr. Fong? We understand members' concern. Dr. Chui, there are 3 bureaus. It's not just Dr. Chui. Now, all the bureaus are represented here. They will be glad to respond to your questions. They must be watching the TV. You let them respond, please. You have a second round. Now, on the CNA mental health service, the waiting time, we do notice the waiting list is getting longer, so we are making our suggestions in the report. Now, first of all, we have to deal with the manpower issue. There's overall shortage of doctors, and that has been so for the past few years. We hope that this will improve in the coming year. In the next 5 years, the HA has 5,800 plus doctors. In the next few years, there will be 2,000 plus more doctors joining the HA. We expect an improvement then, and in the mental health side, there will also be an improvement in the manpower. Now, on psychiatric nurses and other professional personnel, there has been a steady increase. In other documents for LegCo, we said that we will have 20 plus more psychiatric nurses and clinical psychologists to work at the school level and to resolve and provide help for problems that students encounter in school. And the direction is that we will improve the service mode through intersectoral support. And apart from psychiatric doctors and personnel, there's also a need for other support. And the HA is spearheading a cross-sectoral effort. And we will be discussing with the hospital authority. Now, and on the student mental health support pilot scheme, since last year, the HA has sent psychiatric nurse and the support team to the school to work with the school social workers, and they work jointly with the social workers of the NGOs to provide support, and this has been quite effective. This directly offers help to the students and their family members, and the school teachers and school social workers can get more information on how to help the students, and they directly communicate with the psychiatric nurse of the HA, and in urgent cases they get pertinent advice. So this is a worthwhile model to follow, and we will extend that to 40 schools. We will increase the manpower and resources for this pilot scheme. Now, this school mental health support pilot scheme has so far been directed towards known and diagnosed cases. We will also turn our attention to cases not yet detected. So we will increase the number of clinical psychologists and psychiatric nurses to handle as yet undetected cases, so that the cases are dealt with at an early stage. And we hope our multi-pronged approach will be effective in raising both quantity and quality, so that children and adolescents get the right support. Now, of course, we cannot succeed tomorrow, because we have to build up the manpower, and that takes time. Mr. Fong, how long? Now, the PPI, the public-private initiative, joint initiative. Now, on that, we have been discussing with the parties concerned on the approach. There have been different views. We feel that at this stage, even in the private market, there are not that many psychiatrists available. So we are trying to establish the correct mode, and we are talking to private sector psychiatrists as well as the HA. And we feel that this is not easy, but we will continue in the discussion. But we do not have a specific program right now. Now, the SWD and the Education Bureau, anything to add as a result of Dr. Kwok's question? None for the moment. Chairman, can there be a public hearing on this? Maybe at the end of this meeting we will discuss that. Alice Mack, please give me the same amount of time. Well, I have assigned 3 minutes, but you have been speaking for 5 to 6 or 7 minutes. I'd like to ask the administration. A member asked why are there so many members, and we know that the mental health problem for children and adolescents is serious in Hong Kong. The CE said that the waiting time should be reduced to 0. But for children and adolescents with mental health care needs, they are very concerned. They are worried that the government may be short of resources, or there may be a mismatch of resources, so that they miss the golden period for treatment. Now, only 55% of the students complete the assessment for their physical abilities, physical and mental abilities. Now, the HA does some of it, the Education Bureau does some of it. Do some children fall through the net? Now, how can we achieve 0 waiting time? How do we ensure that the test can be completed within half a year? Now, the Education Bureau is represented here. There's a very practical issue. Now, we recently met some parents of ADHD and ASD students. Now, previously, you had an approach which provided additional time for answering questions. And recently, the students did not have this assessment facility, so they couldn't answer the questions in time, and they felt bad about it. Now, I know you have a checklist. How do you help the ADHD and ASD students so that they have sufficient time to answer exam questions? Now, on children mental health tests, now we know that the volume has increased very rapidly in the past few years. We are trying to catch up, and we are in the process of building a new center, but it takes time. It may take till 2021. In this interim period, we have a provisional center in Ngau Tau Kok. It has been in operation since January this year. So we hope that this will enable us to catch up. Now, it's very difficult to engage the right pediatrists, so we hope that we can engage other professional healthcare personnel to assist in the simpler tasks, so that we can take care of more cases. Now, we are considering all the available methods to reduce the waiting time to a minimum. So we are taking both short, medium, and long-term initiatives to improve the situation. Now, on whether additional time should be available for tests and exams, perhaps the Education Bureau can assist. Now, on the ADHD students getting more time for exams, now we look at the actual situation of the student. Now, for ADHD students, we provide some indications through the teachers, and if necessary, the students can be given additional time so that they can be calmed in the emotions. Now, on whether there should be additional time, now we will assess the seriousness, and we will assess whether it's really necessary because of the ADHD condition. So this will depend on the observations during the term by the teachers and the actual performance of the students. Now, the parents are wondering how you decide. Now, in the past, you provide additional time and the students can answer questions. But right now, you say you adopt an approach whereby you take a look at each case, and then the students are very worried. Now this, as I said, there will depend on the teachers' observations and discussions in conjunction with education psychologists, and they will try to provide help. Have you come up with guidelines for schools that no adjustment is necessary? Now, actually, we discuss every year with the schools. We provide briefings and explain to the teachers. Now, I respect that you are an educational professional, but when you provide these guidelines, perhaps you can invite also the doctors and the social welfare workers.
呢一類嘅小朋友
Because they know how these children handles the examination, or how they should be helped to handle the examination. But you think that after giving the explanation very carefully to them, these children have to face other emotional problems, and some are afraid of going to school. And then in some cases they were given new drugs, and then the children couldn't cope with their emotional ups and downs. So parents are very concerned. Because after your intervention, things become worse. But you should handle some other issues, such as the long waiting time. I don't know whether it's because of drug formulary issues. You give some new drugs to them, and things become worse. If you're not happy with the answer, you can ask more questions in the second round. Mr. SHIU Ka-chun, well, I've heard about the same case. Your so-called reminder has made the schools very alarmed, and then the ADHD students have to get the additional answering time on a case-by-case basis. If they are suffering from ADHD, why do you need to assess it case by case? What about physically disabled students? Are you going to assess their physical disability every year? So you are making things unnecessarily complicated. And if I may refer to the paper, the Education, the Food and Health Bureau, and the LWB have put things so nicely that you have displayed this. But you know that the amount of money we spend on mental health is just 0.24. Australia 0.88, UK 0.58. So are you proud because of the level of 0.24? Now you are going to conduct a review. You have an advisory committee led by Mr. Wong Yan-long. Are you going to invest a bigger part of our GDP on this service? And the paper talks about different modes of service. But there's no service policy. Maybe this is the special feature of our mental health policy. The departments concerned, the SWD, for example, and other departments, do you have a long-term objectives for child and adolescent mental health services? We have always referred to a 2017 survey on secondary schools stress levels conducted by Oi Kwan and from the Baptist Church. 1/4 of the respondent secondary students show signs of stress, mental problems. And do we have further breakdowns of Chinese-speaking and non-ethnic Chinese students? And do you have measures to handle such problems? The UK has appointed a minister to handle the so-called lonely elderly problem. Or would you set up a special post to handle the loneliness felt by youngsters in Hong Kong? In the past few years, we have expended much effort in carrying out a review, and we have published a report, and there are altogether 40 recommendations. And according to relevant stakeholders in this sector, if we can implement all the 40 of them, we will see some improvement in the long term. So we are working very hard to implement these recommendations. And the newly established advisory committee on mental health is tasked to advise us on how we can implement and adopt measures to handle the issues. And in terms of funding, we have seen the annual increases. And within the HA system, the resources do not just come from HA, but it's also from some other departments. For the HA, 8 or 9% of its expenditures on mental health services, and there are growth rates, a growth of 3 or 4% every year. Of course, we can do more, but previously, we've also faced the constraint of the shortage of the psychiatrists. We believe in the coming few years, we can expect some improvement, and with more resources allocated to the HA system, we can also increase the manpower. As for whether we have breakdown figures for the ethnic Chinese and non-ethnic Chinese students, well, the advisory committee has actually advised that we should conduct a major territory-wide survey, and then we will try to get hold of data on the state of mental health of ethnic Chinese students and non-ethnic Chinese. And we will also try to identify factors that may affect mental health, and also some contributing factors to the promotion of rehabilitation of the mentally ill. And we also look at the economic implications of mental health in Hong Kong. So in the first phase, there are 3 stages will be covered, from covering the age group of 6 to 17, the school population, the student population. So we'll go to schools to ask questions of students, and if necessary, their teachers and parents. The next group will be the age group of 15 to 25, and these are school leavers. These are people who are already entering or about to enter adulthood. So that's the second group that we want to cover. The third group is the elderly from 60 or more. But we are not going to cover just dementia. We also look at some other geriatric mental health issues. Well, And then we'll cover the adults within the age group of 15 to 75. And there's another one on the disabled, which we conducted some 7 or 8 years ago. So through such major surveys, we hope that we can allocate resources to the needed areas. Mr. Fong, please supplement with more information. It's said that 8 to 9% of HA's budget is spent on mental health services. What about youth? But you are not going to conduct any analysis into the social factors. I don't think they have answered your question about loneliness felt by young people. Are you going to ask the advisory committee headed by Mr. Wong Yan-long to carry out a survey? We'll take a look at what UK has done. There are different practices in different countries. I will try to find out what is suitable for Hong Kong. Mr. Luk Chung Hung, I have been in touch with many cases suffering from ADHD or dyslexia and their parents. One of the concerns is that for those who are younger than at the age of 6, their follow-up service is provided by SWD, and after they have entered P1, it's the job of the Education Bureau, but there is no proper transition. So are you going to miss out on some of the cases? For example, if the parents are concerned that the conditions of their children may be known to schools and they decide to stay away, can you come up with a mechanism so that the information maintained by the SWD would be made available to the Education Bureau direct, or the SWD's service can be provided after the children concerned have progressed to primary education? And according to some organizations, there are more than 20,000 cases or 40,000 cases of ADHD, but only 12,000 or so have been confirmed. So there are hidden cases to the tune of 27,000 cases. So what are you going to do to assess the hidden cases through your surveys? And how can you identify these people? We want to shorten the waiting time, we want to improve the service, and still there are hidden cases. It's because of the lack of proper understanding on the part of the parents or teachers. These children may be regarded as just naughty children instead of children with ADHD. So how would the government do to discover these cases? And the first one is about the teaching and learning grant. If the money is given to the schools, and the schools decides on how to provide necessary services or after school tutorial services, and some parents would like you to give them a grant, and the money should follow the service recipient so that they can purchase services from other sources. Let me first of all talk about the number of cases. How many cases of ADHD do we have? As I've said, we are going to carry out a territory-wide survey that will help us find out the answers to these questions. At present, we do suffer from a lack of sufficient data. As for how they can be helped, how the transfer of information can be arrange, I'll ask the DFH to say something about that, or SWD to say something about that. Mr. Kwok, what's the mechanism? I'll say something about the mechanism, and then I'll defer to the colleague from Education Bureau.
Now, earlier, we already talked to the Education Bureau and organizations offering preschool rehabilitation service. Now, before the children leave the school, we study the performance of the children in school, and then we record the data on a form of set format, and if the parents agree, we provide the records to the Education Bureau, and the Bureau will provide the report to the primary school so that the school knows the needs of the children. Perhaps the Education Bureau can supplement. Now, in the past and at present, the Education Bureau works with the Children's Assessment Service, and there is already an assessment, and in the future, the performance of the children under the on-site the preschool rehabilitation services will also be included in the data made available. Now, on the learning allowance, now this is provided for support within the school and also so that there can be interprofessional assistance for among the teachers to help the children. Now, on the 27,000 hidden cases, now the Education Bureau and the SWD spoke on that. Now, at the Department of Health, the assessment service works in cooperation with the other two departments. We make an assessment, and if the parents agree, then we will share the data. Are there previous cases where the parents do not agree with providing the data to primary schools? Are there loopholes? And just now, Mr. Luk said that there are 20-odd thousand potentially hidden cases. Now, how do you detect those cases? As I said, we hope to conduct a territory-wide survey to collect the data. According to existing HA data in the past few years, the annual increase has been quite sharp. The increase has been from almost 20,000 to 30,000 cases. Now, we understand there are cases which have not yet been detected, and in the future we will conduct this more comprehensive survey. Mr. Poon Siu Ping. In paragraph 3 of the document, it says that in 2015 to 16, the HA, the psychiatric service provided help for 32,000 children and adolescents. Now you said there has been an increase. Now for 2017 to 18, the Secretariat said that there were 33,900 cases, so there has been an increase. Now you said that there has been a shortage of doctors. Now, in your assessment in 2018 to 19, how many new cases can be assisted? And in paragraph 14, it's mentioned that in school social work guidance service, and said that starting 2018-19, the government will increase the resources to provide social worker service, so that there would be one social worker per school. Now, how much more resources would you add? And to attain this target, how many more additional school social workers will you need? And is there a concrete timetable and a blueprint? Now, the HA first, Dr. Cole. Now, there are new cases in quite large numbers, and the service for adolescents is not quite adequate. Every year there are almost 10,000 new cases, and as Mr. Fong said, the increase is quite large, and the various sectors have a very tight manpower situation, and we know that there's a strong demand in children's mental health section, so we will deploy our manpower accordingly. Of course, there is more manpower on adult psychiatric side, but we will try to deploy our resources in an optimum way. How about social workers? We hope that there will also be school social workers in primary schools. There are different ways. Now they can utilize allowances. Now some schools are making use of supplementary teachers. We will discuss with the schools. Have you assessed the additional resources needed and the plan? I don't have the data at the moment, sorry. Mr. Kwok Wai-Keung. Now, the topic is very wide. Now, members talked about ADHD children. Now, why is it that there are several pages on services provided, but there is still only 55% of the children only who receive all the tests within 6 months? Now, of course, on those cases already completed, of course, do go ahead. And then we have heard some comments that there's a new drug. I can't say the name, but it has more side effects than the previous drug. So why has there been a change? And what's the current situation? And in the recent period, I came into contact with children who are non-ADHD but also have other needs. Now, they tell me that there is very difficulty getting services in the private sector, and will you offer a one-stop shop to the parents so that they don't have to run all over the territory to find the right sources of help? Now, I hope that you can complete the assessment ASAP and follow up closely so that the children are provided with the most pertinent service. at least this will help the parents who are already very taxed in their caring for the children at home. Mr. Kwok might be talking about what we call Ritalin. Now, of course, we have certain tendering procedures for procuring drugs, and Ritalin is a drug which has already passed the patented period, so some pharmaceutical manufacturers do manufacture them, and some parents tell me that they make use of broken pieces of drugs. Now, I hope that the manufacturers can provide the right the drugs in the right form. Now, how about side effects? Now, we will talk to the patients' associations to find out the situation. And the one-stop shop, Mr. Fong or other departments, perhaps we can ask the Department of Health or the Education Bureau. There is a collaboration mechanism on what follows after assessment. SWT. After preschool assessment and the child is awaiting service, we have an on-site preschool rehabilitation service. We started this in 2015 and we have regularized it, and there are many professionals involved. There are professional therapists, physical therapists, and other professionals involved. And it's hoped that the preschool children who are waiting on the waiting list, they can receive the assistance at the preschool service, children's service centers and at the schools. We hope that this new measure can provide one-stop service at the schools for the children, and also there's learning allowance for the parents to apply for, and they can then use the allowance to get various types of therapy, like language therapy or physical therapy at the NGOs. Then this clock. Now, I'm very concerned. Now, at the public hospitals, at the mental health section, the waiting time for children is as long as 3 years. Now, the children need to be identified and treated at an early stage. Now, if the treatment period is passed, then the treatment may not be possible, and that will affect the rest of their lives. 1 year is too long. And you talked about preschool service. Now, the children, after they attend primary one, they still have to continue to receive treatment. Now, what will happen after they graduate to primary school? Now, what services are available? The waiting time is so long. Now, maybe by the time they attend primary school, the services that they queued up for are no longer available. Mr. Fong, on the waiting time. We also feel that it's not acceptable, and I also try to explain at the outset that firstly, we will try to increase the manpower. Now, in the past, we are short of doctors, and right now there are now 5,870 doctors at HA. In the next 5 years, there will be 2,000 medical school graduates who will register, and we think that there will be room for more psychiatrists.
We hope things will improve. Well, that's the solution. That will only happen in the distant future. But that's the ultimate solution. But is there something we can do about the mode of service delivery? Can we make better use of psychiatric nurses and other allied healthcare professionals to offer some help before the medical consultation can be offered? And can something be done to help the children? Apart from medication, there are other treatments and services that can be offered. Are you confident that you can really cut the waiting time? If we look at past records, we will see that the number of cases kept increasing very rapidly. So much will depend on the rate of increase. So we need to look at the number of doctors we have, how many more we can add to the list, and how many what can we can do to increase the number of psychiatric nurses and so on. And then we can also consider adjusting the service delivery mode. And then there's the suggestion to go to the schools to offer this, to help them, because apart from medical consultations, most of the time they will be at schools. So we hope that by changing the service mode, we can, in the long term, we can reduce the waiting time. But at this point, we cannot really give you a definitive answer on the extent to which our waiting time can be cut. We know that there are people on the waiting list, and while they're waiting, we still want to offer some help, some service. And there are also hidden cases of among students in schools. So we also try to find a way to identify them. When a student is waiting for an assessment for ADHD, we hope that the education system, the schools, will still be able to help them. So we advise the schools to provide a timely assistance to these students before the assessment is done. So we have special teaching kits for teachers to improve the learning for ADHD students, and also to enable students, teachers to manage the classroom teaching, and also to facilitate students in better managing their school attendance. Mr. Yip Kun-yun, a lot of things are mentioned in this paper. You have the incidence rate for youth psychiatric cases, according to WHO, says the paper. About 10 to 20% of the youth population may have some mental problems. So that's a general description. And then we should have a given set of data for Hong Kong, but instead we get some very piecemeal figures. so that we are not able to make any meaningful comparison with the global situation. Are you talking about the background brief from Legislative Secretariat? That's from the Secretariat staff. The government paper is bracket 01. The background brief is bracket 02. All right. If that's in that case, let me return to the issues. One of the problems we encounter is that if it's important, we need to identify children with mental problems, and we also have to prevent the onset of mental illnesses. Of course, the community and the families have to play a part, so are the schools. Some parents would like their children to get a good head start in life. There is pressure all around from the school enrollment system, and also the fact that children have to take the TSA assessment. I was just referring to a background brief prepared by Legislative Secretariat. I still want to talk about that paper now. In paragraph 8, it said that from 2017 to 2017 school year, starting from that year, the learning support grant will cover students with mental illness. The learning support grant is given for the 8 types of special educational needs. You can see note 10 of the paper for the details. But now you cover mental illness, but there is no change in the amount of grant. It just subsumed mental illness into the scope of the grant. In other words, you want these teachers or the counselors in schools to do more without proper financial support. So what is the government going to do to provide real support to schools in helping the student with mental illness? We have the Undersecretary now. Would you be responding to these questions, or Mr. Fong would do it? On the question of helping students with mental problems, I'll defer to Mr. Lai from the Education Bureau. Thank you, Mr. Yi, for your questions. In providing the learning support grant, we would cover the students with mental illness. In the past, the service was provided through school counseling. And now we want the teachers responsible for the guidance and counseling being also involved. So this is an enhancement in support. In the schools, there are different levels. First of all, we would do promotion in promotion, and many schools have applied for funding, support to organize activities, to help students to develop their resilience and their ability to cope with adversity. And we also provide resources to schools when the students are identified with obvious risks. And Mr. Fong has said that we have services involving different interdisciplinary support for those who are identified with mental illness. What about have you increased the amount of the LSG? Not for the moment. Every year the adjustment of the grant is made in accordance with a CPI. And at the same time, we are alive to the views from the education sector on how we can do a better job in coordination. Anything from Mr. Fong? When we carry out the collaboration program, we did give more resources to the HA to employ nurses to provide the service in the schools. But since the workload of teachers will also increase, so we talked to the Education Bureau to cover the students with mental illness in the to the list of 8 SENs. So much will depend on the number of cases in the school. Depending on the number of cases, the school will be able to get an LSG of a suitable amount to handle the cases. The grant may be sufficient to hire an additional teacher if there are sufficient number of cases. So we have provided substantive support, and in some schools they have been able to engage an additional teacher. I would have to take a look. Can this be assessed in quantitative format, in a quantitative way? I'll try to find out whether the schools are getting adequate support and subsidy. You're giving me a lot of pressure. I have 3 minutes, but the bell is ringing next door. I don't want to wait for another 8 minutes. I've been puzzled by the recent promotion on the part of the government of gaming. I know young people don't like what I'm going to say. I want to talk about the relationship between gaming and mental problems. In the special FC, there was a question about addiction to the gaming. There are people who are successful in gaming, and it seems that we need to promote it. And then some of the commentators have been ridiculed on the internet. I've asked experts in other places where gaming is popular, for example, the mainland, Taiwan, and South Korea. They have put in place policies to minimize the side effects. They won't just give $100 million like our FS to the promotion of gaming, and that's it. Some of them gets addicted, and they just can't control themselves. They said that we want Hong Kong people to be responsible and have a vision for the country and for the world. So I don't know how these enthusiasts of gaming can fit into this description. I'm more in favor of providing support to our young people, but I have to be mindful of the downside of whatever is going to be promoted. It's that gaming has to do with economic and commerce, but mental health has to do with the job of 3 bureaus, FHB, LWB, and EB. But the promotion of gaming involves 6 bureaus. And unfortunately, WHO listed gaming disorder in the International Classification of Diseases this year. Now it's a disease. It's a game called gaming disorder. And that is to say, serious indulgence in gaming is a disease. and it's alarming in the case of South Korea when it comes to the young people getting addicted. Is that in the recent 3 years, the number of cases seeking help has doubled in 3 years. The existing service system cannot help them, and the waiting time is 8 months. And then there are two service centers offering help on a self-finance basis. So what can they help? What can they help? Either you play e-games or you don't. I don't want young people to do nothing but playing games in front of a monitor screen. What about positive social values? Have a sense of gathering and a vision for the world. It seems that it's going to be quite the opposite. Who would provide an answer?
The Undersecretary, perhaps the Department of Health, Dr. Kwok can supplement. The WHO classifies it as a disease. Thank you. Concerning e-gaming and the gaming disorder, several years ago when we joined the discussion of international specialists, we noted that there can be health risks from such addiction. So you are aware. We understand the development. Did you tell the financial secretary he forked out $100 million? We noticed this development, and the WHO did held regular meetings of experts, which we joined. And in Hong Kong, apart from the DH, there are other government departments and other professional organizations which offered views on this. So how do you explain that the assistance seekers doubled in 3 years, and the financial secretary has offered $100 million? You observed now doubling in 3 years, and the WHO calls it a disease. The FS provides $100 million. You must administer heavy medicine. Now, which department or bureau is responsible? Is it Education Bureau? The other two departments might provide some comments. Mr. Fong, now earlier we responded in writing to a written question at LegCo, and for those who are addicted to e-gaming and become mental case, now the HA will treat that, will treat such cases when it's aware of it. And concerning e-gaming, of course, over-addiction is a problem. That's true for all activities. The young people queried the members on the internet about this. Now this is getting the attention of WHO. The WHO doesn't call jogging a disorder. Bodybuilding, it doesn't call that a disorder, but it's calling e-gaming a disorder. Now the 6 bureaus and departments, what is Education Bureau doing? I don't know what the SWD's response is. The Innovation and Technology Bureau, of course, they want to promote this. Home Affairs Bureau. Now, well, perhaps this is a major issue, and you can write for there to be a joint meeting. Now, so perhaps the other bureaus can work jointly on this. Dr. Fernando Chung. Now, on ADHD, the Education Bureau recently issued a new guideline, and the psychiatrists have to reconsider the mode of exams, and the extra time was discontinued. So I hope the Education Bureau will review the picture, and they should be able to tell us that this is a misunderstanding. The arrangement should not be lightly cancelled, and that will assure the parents. On the mental health of adolescents and special education needs. Now, on the assessment side, there has to be a long waiting list, and in the Department of Health Assessment Center, the waiting time is deteriorating. They said that 90% can be completed in 6 months, but now it's only about half. This is not acceptable. The government said it has added the resources, but actually the waiting time has worsened. So there has been insufficient resources added. Now, will the FHB add more resources? What will the DH do? Now, on preschool rehabilitation service, the SWD provides training. Now, there are special children's service centers, and now you add the places for on-site rehabilitation service, but only 40% of the kindergartens are receiving help. Now the Labor Welfare Bureau is not here today. Well, there is, but it's rather junior, at a junior level. Now, Mr. Kwok is actually of the SWD, but there's no one from the Labor Welfare Bureau, only from the departments. We are talking about adding more resources, Mr. Chairman. Now, well, some receive service, but then at primary school, it's a learning support allowance, about $13,000 a year per student. Now, will there be something like a rehabilitation, on-site rehabilitation service, so that there are various therapists offering help at the school, and will there be a special room for that? So the service is not available once the children enter primary school. And some ADHD and ASD students are referred to the HA, to the Children and Adolescent Psychiatric Health Unit, and there they may have to wait 2 to 3 years. Now, Mr. Fong said that they will train psychiatric nurses, but then the waiting list is getting longer. It's disastrous. And now you are here, there are different departments and bureaus. Now, will you extend the school rehabilitation service to the primary school and secondary school. This is a major issue. Undersecretary, or is it Mr. Fong? Perhaps Mr. Fong can assist. We do agree that now the waiting time is unacceptable, as I said. So we are trying all the means available. As I said, we will increase the number of pediatrists and psychiatrists and psychiatric personnel, and in the future we will have 2,000 more doctors in the next 5 years, so we may be able to correct the problem at the root level. In the meantime, we are doing other things. Now, there is a provisional center at Ngau Tau Kok for preschool assessments, and in the longer term, there will be a formal center added in the next couple of years. And in the meantime, we are hiring more doctors, more pediatrists to offer help, pediatricians, and we will also deploy existing psychiatric nurses. There are 4,000 of these nurses, so there's more room for better deployment of these nurses. So with this multidisciplinary team, we can provide greater support. Very often, it's not just the taking of drugs. Other types of support are needed. And at the student mental health support pilot scheme, and in the school environment, through the psychiatric nurses, through clinical psychologists and school social workers and teachers, they can provide support jointly, and the HA will provide sufficient resources. And the learning support scheme at schools will be extended to students with psychiatric needs. So that will also provide pertinent help to the students. So we are working on both fronts. And at the HA, we are making similar initiatives. We hope that there will be to do more on a multidisciplinary basis, and if the waiting time is getting longer, as mentioned, maybe we can deploy more personnel from the adult psychiatric services. Yes, the waiting time is too long. Now, on the continuum from preschool to primary and secondary schools, perhaps the SWD and Education Bureau might supplement. Now, on execution, can you offer some comments? Now, on the on-site preschool rehabilitation service, now there are 3,000 places. In October this year, we will add 2,000 more. That will be 5,000. And in November 2019, there will be 2,000 more. So by December that year, there will be 7,000 places. And in 2018 to 19, up to 2020-21, there will be also an addition of over 1,000 places under certain plans. So there will be more additional resources in preschool services, and this will help to provide the the help needed. Now, there is a children's rights task force. Now, that task force has already come to an end. It has. Perhaps we can take that to the House Committee. There are now 15 minutes more, 4 members yet to speak. Now maybe we can extend the meeting to 6:45.
Mr. Kwong Chun-yu, one of the emphasis for this meeting is mental health of children. Now the waiting time is 74 weeks to 89 weeks. So, Under Secretary, you do know such information. How many people are working on mental health of children and adolescents? Under Secretary, the waiting time is a concern to service users and the community. Because it means that the problems cannot be addressed in good time. In the public health care system, we will handle the urgent cases as a matter of priority. So for the non-urgent cases, the waiting time may be long. I was late in joining this meeting. So I believe that the HA would have told you that they have ways to address the cases which have to be dealt with more urgently, and also how they can prioritize different cases, and how they can involve other healthcare specialties in offering services. I wonder if Dr. Ko would like to supplement. We understand that the waiting time is too long. We have a triage system. Even with the triage system, we are talking about a large number of cases. And as Mr. Fong has said, we hope that through the interdisciplinary support team, we can tell apart or identify urgent cases, and those cases will receive priority treatment, so that while we cannot enhance the service capacity very quickly, so we can do a better job in prioritizing different cases. And also we can involve more specialties and different service personnel. For example, we can ask the psychiatric nurses to identify more urgent cases so that they can get timely treatment. How many people are dedicated to mental health service for children and adolescents? As at the end of December 2017, we have 351 psychiatrists, 2,500 psychiatric nurses, and a few thousand community nurses. But there are different subspecialties, for example, geriatrics and pediatric cases. And some doctors would see patients of different ages. So we don't have a dedicated unit or dedicated team. So you don't have a dedicated team for the mental health cases of children. Well, there's no subspecialty of pediatric psychiatry. So psychiatrists offering service to adults would also be handling cases of children. We have seen the very marked increase in the number of cases of children suffering from mental illness. And also the psychiatric department is suffering from serious brain drain or wastage. But if you are telling us that you can only give us the overall surface pattern, well, we've been told that the waiting time can be 1 year, it can be 3 years. A lot of things can happen to a child in 3 years. And as the Food and Health Bureau representative have said, this is not an acceptable waiting time. But now it turns out that there's no dedicated team of doctors to handle the cases of children suffering from mental illness. What are you going to do to cope with the rapidly rising caseload? How can you manage this queue, which has apparently no end to it? Can you commit dedicated manpower to this service? Yes, we do suffer a serious problem of wastage of psychiatrists, because some colleagues would opt for the private sector. But all in all, we are seeing a small increase in net increase in the in manpower. But the service needs also increase very rapidly, so we need to redeploy internally some manpower to handle these cases. So it is already a priority to HA. Maybe you can get the figures for us. For example, in the past 3 years, how many people were deployed or redeployed to handle these cases? Please tell us the data later. It's just like pouring water into a leaking cup. And at the same time, the number of cases is increasing very quickly. But you are not really getting a solution, because you have a serious manpower wastage. So how can you cope? It's not very meaningful by adding more doctors to the service. Dr. Chui, well, this is a question that the Food and Health Bureau and HA will have to face seriously. We know that there is a manpower wastage problem for psychiatrists. We have got plans to increase the number of medical graduates and also resources. We are providing more resources to HA, so they would have to find ways to attract more people to work in HA and to reduce losing their doctors to the private market. I think apart from setting a certain number of consultation sessions by the team of psychiatrists, we'll look at other ways to shorten the waiting time, if possible, or at least to slow down the lengthening of waiting time. I would like to particularly talk about ADHD. According to government's paper, in 2016-2017, among the 30,000 cases, half of them will be assessed to have ADHD or autism. According to the paper, the government is going for early identification, and even the maternity and child and health centers can play a part. Can you tell us some figures? I would like to know the average waiting time. I mean the waiting time for assessment by one of the agencies. According to some parents, and I have looked into this problem, some parents know that they may have to go to the private sector for the treatment, but the first thing they want to do is to have early identification so that the parents can make a decision on how to follow up the matter. But if it's assessed to be a negative case, everyone would be happy. But can you tell us more about the early identifications and assessment service? And for the early childhood centers, we know from past papers that you have more training centers for early or preschool and early education services, and the services would include early identification of ADHD. How many early education and training centers do we have in Hong Kong? And I've heard from the answers given to some members that in the future there will be 7,000 places of outreach support and rehab services to schools. So on-site pre-school rehabilitation services. I understand this to be a kind of service provided to kindergarten teachers. It's so-called it's done under the so-called train the trainer approach, so that the teachers will know how to deal with students with autism or ADHD. But can you go do this in a more direct way? Why don't you train people who can directly handle these cases, and not doing this through the teachers? Undersecretary, some of the issues are handled by the Department of Health and HA. May I now defer to Dr. Chung first. The Maternal and Child Health Center under the DH provides services to the children from the age of 0 to 5. And there are programs such as vaccination service and also the health monitoring service for children. The member talks about early identification and assessment. So when their parents take these children to the MCHC for the monitoring, they will be referred to the appropriate service when the issue and the symptoms are identified. But sometimes at that early stage, the symptoms do not warrant a referral right away. So parents will be advised on what to watch out for. But for those more obviously identified, the referral service will be offered. MCHC is one of the agencies that would do this. Some other agencies such as preschools, kindergartens, and private doctors will also play a part in early identification. Early education and training centers, how many of them? How many are there? I said as at the end of March 2018, we have a total of 3,445 places in these training centers. But how many centers do we have? I'll supplement later. All right, please tell me after the meeting. and also the 7,000 places. Would you adopt a more direct approach, train some teachers and so on and so forth who can really tackle the issues? Mr. Kong, what are those 7,000 places about? It covers training for teachers and also what the parents can do to provide the support. And also it would cover training the children. There will be on-site consultation and teaching in the schools, and the direct service will also be offered to the children. So it covers various aspects. Thank you, Dr. Helena Wong. Thank you, Chairman. I want to follow up an issue of related to the lead in water incident.
34 children were found to have delayed development due to excessive lead in blood, and there have been other children affected too, and that was 1 year ago. And these 34 children with delayed development, and 10 with similar development problems. Is it merely the intelligence that's affected, or is the psychiatric impact also in terms of ADHD? We thank Ms. Wong for her question. Now, a small number of children are receiving follow-up treatment and referrals in pediatric departments. Now, I don't have the data right now. Perhaps we can supply that after the meeting. Now, perhaps the administration and the HA can tell us what is the situation with the 34 and 10 children, and where have they been referred to? Is the HA following up? Can you provide written information? Yes. Now, the Secretariat has provided a background brief, and it talked about learning pressure of students in paragraph 25. In 2015, in October, there was a guideline issued. It's the school-based homework policy. The school will decide how much homework is demanded of the students at the primary and secondary level. Has the Education Bureau assessed how many hours of homework are required, whether there has been an increase or decrease? All along, we remind the schools that homework should stress quality rather than quantity. Can the Education Bureau trace the impact of these guidelines? Perhaps the schools don't really follow your guidelines, and if there's less homework, by how much? And what is the impact on the students' mental health? Will you formulate certain indicators on pressure and student health, mental health? And TSA it's up to the school whether to send all the students to the test or to send the whole school. And 80 schools are sending all the children to the test, and the DH and the Education Bureau can trace what's the impact of homework on students' mental health. Now, this may not be directly related to our topic today, but perhaps the Education Bureau can provide a written submission. Now, I'm hoping that they actually take action. Now, the government says this is merely exercise, not and it won't create pressure. It's not supposed to create pressure. Well, I'm talking about mental health. Mental health can be from exam pressure. We have to deal with prevention besides treatment. Now, if that's the source of the pressure, we have to deal with it at source. We don't want to leave it to the HA to treat all the cases. Perhaps the Education Bureau can supplement. I will have to gather the information from my colleagues. Perhaps we put that on record. Perhaps the Education Bureau can find out what's the approach among different departments. Dr. Helena Wong is probably right. Exams do create pressure. Please provide a written answer. Now, we cannot cover adolescents' growth problems in this meeting. Now, for those children who need treatment, now the waiting time is so long, it's very worrying. Now, if there is indeed mental health problem which requires treatment, and if you make them wait for 2 years, now that may destroy the chance of recovery. Now, I'm also a member of the hospital authority. I sit on the management committee, and I have expressed my concern on other occasions. Now, on determining who should be on the waiting list. Now, there is no clear guideline there for professional determination. Now, if this is a student attending school, then the school, including the school social worker, do they have the capability to make the professional determination on whether psychiatric help is needed? Because teacher and counselor help may not be adequate. This determination is very important. Now, other members express similar views, but I must stress that. Now, through determination at the school, if it's determined that there is a need for psychiatric help, then we hope that this diagnosis will not take so long. Treatment might take a long time, but the first determination is very important to find out whether there should be follow-up psychiatric treatment or whether one should continue to rely on the school social worker. Now, a more specific question. Now, it might appear very good, and in that we have Children's Hospital. Now, will the Children's Hospital provide support in terms of hardware, software, or manpower? Will they have an impact? Do they have a psychiatric service at the children's hospitals or psychiatric ward? Now, on identification, we agree with the direction. Now, Mr. Fong mentioned just now, we hope that we can work with the schools teachers and social workers to identify the children's needs. We believe that there might be a large number of students who need psychiatric help, but not all of them will have to attend psychiatric clinics. They may need help from pediatricians or family doctors. Now, usually these children need to be taken care of in the community, so the school platform is important. The children's psychiatric centers provide more technical help, so now family doctors and pediatricians in other countries do provide help to these children, so we think they can play a role. Now, we have discussed this matter a long time today, and we talked about the identification issue. There is this platform, the Student Mental Health Support Pilot Scheme, involving different bureaus and sectors. There are now effective assessment equipment in the community. Now, if you do that process at the primary care level, then you won't have such a long queue for the first determination. Now, after preliminary assessment, then they can receive support to the family doctors and pediatricians, and so the children can receive help at 0 to 6, age 0 to 6, and the queuing time between 6 and 12 will be reduced, so this will enable the children to get help much earlier, and so you don't have to wait for the number of new psychiatric doctors. So many policy issues have been covered today, and some answers have been received. Now, I don't see much interdepartmental cooperation, however. Now, members can discuss their concerns within their own panels. There are welfare concerns, healthcare concerns. So I believe after this meeting, if there's further need, we can hold further meetings. I don't know whether Mr. Michael Tian will come up with a request for a joint meeting by the 6 panels. Now, we hope that you do provide more resources and manpower in the future. Now, we hope that you will provide a better service to reduce the waiting time. Thank you.